Hello, and thank you for choosing the CDCA-administered ADEX examination for dental licensure. This is part 1 of 4 videos getting you acquainted with the process for the Perio Restorative Examination. The Perio Restorative Examination consists of 3 parts, which are graded separately. The Anterior Restorative, Posterior Restorative, and the Periodontal Scaling Examination. You will treat your patient in one clinic, and he or she will be evaluated by examiners in another area, maintaining your anonymity and the exam's integrity. At no point will you have contact with examiners in the evaluation area. There are many people involved in the examination process. The chief examiner is responsible for the overall exam. You will meet the chief on orientation day. The chief is the only person who may be present on either side of the exam floor and is not involved in grading. Typically, there is a check-in desk and a check-out desk staffed by a desk coordinator from the CDCA. This area serves as a gateway between the testing and evaluation sides of the evaluation floor. They check paperwork, act as timekeepers, and monitor the flow in and out of the evaluation area. Patients move through this area in order of sign-in. Clinic floor examiners, or CFEs, are present on the candidate's side of the clinic and will assist you through the steps of the process. CFEs can help you be sure your paperwork is complete and exam protocol is followed. Every time a patient moves from one part of the clinic to another, a CFE should be involved.
Would you like to come with me? Yes.
Examiner assistants, also called runners, can escort patients to and from the evaluation station also. Be sure to consider all requirements in the written manual when choosing a chairside assistant. They'll need to present 2 passport-type photos and a signed chairside assistant agreement to a CFE on arrival. Assistants will be given a badge before the examination begins.
Okay.
Your patient will need to meet special requirements to participate in the examinations.
Okay.
Please read all
your last
clinical and
physical
administrative
examination
requirements
was
listed in the exam
April.
manual. Remember, patients with a history of oral bisphosphonate use are permitted to participate in the restorative exams only. IV bisphosphate administration eliminates any patient from qualification for any portion of the perio or restorative exams. Patients with latex allergies may sit for the exam if the clinic is certified latex-free. Let your patient know this is not a typical dental visit and may take several hours. A single patient may participate in more than one part of the examination. Plan to meet your patient when they arrive. Patients should not ask for candidates by name at the exam. Patients should dress comfortably and may bring a sweater or jacket. Cell phones and other devices can only be used by patients in the waiting areas. Patients should bring some reading material for clinic area use. Budget time if your patient will need lunch. Lesions on the selected tooth needing treatment must be noted on the progress form. When considering patients for the restorative examination, it is recommended only one candidate treat an anterior tooth on any one patient. For the posterior tooth, one candidate must complete all treatment necessary. Any lesions present must be completed by the end of the examination and will be graded. However, if 2 proximal lesions on adjacent teeth exist, the candidate may treat one, leaving the other for a second candidate. Lesions other than the one required for the examination may be treated prior to the exam day. Class 5 lesions cannot be part of your treatment and must be completed prior to the examination. Supporting documentation in the form of clear and diagnostic radiographs is required for any submitted lesion. For the anterior restoration, a periapical radiograph is required. For the posterior, a bite wing and PA are required. Radiographs must be dated within the last year. Original film, film copy, digital, and film-sized printed digital radiographs of good quality are acceptable. If digital prints are used, make sure the images are printed on high-quality photo paper and include patient name, date they were taken, candidate ID number, and indication of left and right. If these prints do not provide sufficient resolution and clarity, they may be rejected. Radiographs may not be returned. Monitors may be used to display digital prints if allowed by the host school. Periodontal treatment surfaces should be selected at least 48 hours ahead of the exam and entered online. Visit the candidate portal and use your credentials to log in and enter them on the treatment selection worksheet. Print a copy of this and take it with you to the exam. You will want to check this against the computer on site. If this is not possible to do ahead of time, you may make your tooth and surface selection at the coordinator desk. A panoramic or full mouth series taken within 3 years must accompany the perio patient. There may be a penalty for submitting poor or non-diagnostic quality radiographs. In the perio restorative examination, allotted time is determined by the number of exam parts taken on a single day. A candidate taking one part will have 4 hours from the time the lesion or case is approved. A candidate taking 2 parts will have a maximum of 7 treatment hours. 3 parts are allotted a maximum of 9 hours from the case acceptance to stop time. On exam day, setup is from 6:30 to 7 a.m. Beginning at 7 a.m., CFEs will check the first restorative patient's paperwork. Patients must be seen in the evaluation station for lesion approval next. Your patient will be evaluated by 3 independent examiners each time they are evaluated in the evaluation station. Restorative prep can begin once they return, but no sooner than 8 a.m.
Patient gets sent,
CFEs will check paperwork for perio patients and authorize submission to the evaluation station beginning at 7:20 a.m. Periodontal scaling can begin when the patient returns. The maximum treatment time for the perio examination is 90 minutes. The time your patient is waiting or in the evaluation station is part of the total allotted exam time. All patients must be in line by the stop time. Anticipate at least 30 minutes evaluation time per trip to the evaluation station. If your last examination of the day is perio, your patient must be approved for treatment at least 45 minutes before the stop time. For example, a candidate taking 3 parts must begin treating their perio patient no later than 4:15 p.m. For candidates taking only 2 parts, that would be 2:15 p.m. If your last patient of the day is restorative, the lesion must be approved to start preparation at least 1 hour and 45 minutes before the stop time. This is approximately 3:15 p.m. for candidates taking 3 parts of the exam and 1:15 p.m. for those taking 2 parts. The patient must be in line for prep evaluation 1 hour before the stop time. The patient must be in line for final restoration evaluation by the stop time. Remember to allow time for any modifications throughout the preparation.